Welcome everybody. I think we'll make a start. There might be still a few people joining, but welcome to our So What seminar. It feels a bit dark and cold out there, so I hope everyone's got a warm drink and maybe a blanket or something. And you're looking forward to hearing a little bit about our research highlights. So I'll just give you a bit of a sense of the rundown if we move on to the next slide. The aim of this seminar is to talk through some of our key findings. So we release a key findings report every year, and this is just to give some highlights. I'll say a bit more about that in a minute, but just to give you a sense of how the session will run. I'm introducing it now. And then we've got 4 presenters who are going to give some highlights: Tanya, Emily, Julian and Sarah. If we're on time by the end of those presentations, we will have a quick break, and then we've got our panel, which includes the speakers but also our young person and parent champions as well. So there'll be a chance to ask questions then. In terms of communicating with us, the chat function is turned off, but you can use the Q&A. If you have any questions, please do write them in as you're watching the presentations or as part of the panel. And we'll try and get through as many of those as we can. Just to let you know also that there will be, there's an option to see sort of closed captions. So if subtitles are helpful, please do turn those on. Also, just to say, in terms of putting the questions in the Q&A, there is an option to make that anonymous if you want to. And I believe there's something where you can upvote somebody else's question. So if there's a question that's something that you'd like to hear the answer to, you can promote that using the upvote option as well. Okay, shall we move on to the next slide? So I'm just going to give a bit of context in a minute, but before I do that, just wanted to introduce everybody. So maybe if you can all just for a minute pop your cameras on to say hi. So I'll start with myself and then I'll pass on to colleagues. I'm Jess Dayton. I'm Director of Applied Research and Evaluation at the Anna Freud Centre and Director of the Evidence-Based Practice Unit. And I'm also a Professor of Mental Health and Wellbeing at UCL. Julian, would you like to introduce yourself next?
Sure. Hi, everyone. Thank you so much for joining us today. My name's Julian. So like Jess, I'm based at the Anna Freud Centre in UCL. So I'm Head of Evaluation here at the Centre, Professor based at UCL, and another of the Directors of the Evidence-Based Practice Unit.
Thanks, Julian. Emily, do you want to go next?
Hi everyone, I'm Emily Stapley and I'm a Senior Research Fellow in the Evidence-Based Practice Unit.
Thanks, Emily. Over to you, Tanya.
Hi everyone, I'm Tanya. I'm also a Senior Research Fellow based at the Evidence-Based Practice Unit.
Thanks, Tanya. And Sarah?
Hi everyone, I'm Sarah Delati and I'm a PhD student based at UCL and AFC.
Thanks, Sarah. And Vicky?
Hello, my name is Vicky. I'm a parent champion representing some of the other parent champions from the Anna Freud Centre. I'm a parent champion because I've had 2 out of my 3 children use mental health services. I wanted to support change.
Thanks, Vicky. And we do have Selina hot-footing her way over to join us, but unfortunately is caught up with delays and problems with public transport at the moment, but hopefully she'll be here in time for the panel, and she's our young person champion. And last but not least, Martha, would you like to introduce yourself?
Hi, yeah, I'm Martha. I'm the Programme Coordinator here at the Anna Freud Centre, working with Applied Research and Evaluation in the Evidence-Based Practice Unit.
Thanks, Martha. And Martha's going to field our Q&A section a bit later on. Great, if you can move to the next slide then, I'll just give you a bit of context about us. So the evidence, you'll have heard there, but many people sort of reference the Evidence-Based Practice Unit. So just to give you a bit of a sense of who we are, it's a bit unusual in terms of a unit. It sits across 2 organisations. So the Evidence-Based Practice Unit is in fact a collaboration between the Anna Freud Centre and the Faculty of Brain Sciences at UCL. So, and the reason for that is so that we can sort of try and do what we would call applied research, so research that kind of bridges the gap that we often see between sort of quite what you might see as kind of ivory tower, sort of more traditional research, and the sort of more innovative practice side of things, to try and sort of make sure that whatever research we're sharing has a sort of practical application, really. We're most of the team are sort of housed at the Anna Freud Centre, but some are also at UCL or have dual roles at UCL. At the centre, we work very closely with the Child Outcomes Research Consortium, also known as CORC. They're a membership organisation that works with mental health services and voluntary sector organisations and schools to think about how we can sort of draw on evidence and also build evidence, in all those different settings to improve the support that's there for children and young people's mental health and well-being. Next slide, please. So just as a bit of context for these seminars, I suppose they kind of typify that approach, really. We feel there's a lot of sort of research gets presented perhaps to other researchers without a sense of sort of thinking about what it all means and how it can be used. So that's exactly what the So What is about. We developed it a little while ago, and we in fact had one of these seminars last month that was focused on sort of social support and support in the immediate environment of children and young people. So we try and pick a topic, and usually what we'll do is look at that topic from different angles. So different researchers, we might have practitioners join us, and we also get a lot of value from talking to our parent champions and our young people champions about what the research might mean and how we might use it, essentially. This one's a little bit different because the point here is to talk through our key findings. So just to switch to the next slide so I can say a bit more about that. So key findings is something we produce every year. We've been doing it for a little while. I tend to think of it as our Christmas present to ourselves, because it usually comes out at this time of year. And it's a bit of a digest kind of roundup of what we've done throughout the year. And we think of this in sort of, we think of it in sort of the dimensions that we kind of pin all our research to, if you like. So just I think on the next page, perhaps, there's a bit of a breakdown of those. So we tend to talk about our research in terms of risk, resilience, change and choice. So I'll just say a tiny bit about what each of those are about. It's just a way of kind of being able to sort of reflect the breadth of what we do, really. But when we talk about risk, we're talking about the range of sort of conditions and experiences that a young person might have that might be associated with an increased likelihood of experiencing mental health problems. And we'll talk about some of those today, but this doesn't mean that definitely if a young person has a particular attribute or has had a particular experience, that means they will develop a mental health problem. But the research tells us that some of those experiences might also lead to other challenges which might be associated with an increased likelihood of difficulties of those kinds. So it's trying to understand a bit more about what that relationship looks like, what the range of factors might be. And then resilience is thinking a bit about the sort of the opposite side of that sort of seesaw, really, about what are the sort of protective factors and supportive factors that young people and families might be able to draw on, that might help them manage in the context of difficulties, that might help them sort of achieve, good well-being or not experience mental health problems. But it's also about thinking in a what we would call a sort of ecological way about the support that's on offer for young people. So rather than just thinking about grit or character or those kinds of things which tend to be about an individual's response to challenges, we think of resilience as this sort of dynamic system around young people and around families. So it's about how well is the family system supporting that young person, how well is the school system supporting them, how well are their communities supporting them, what kinds of things can they draw on all those environments that help them manage when things get difficult. Change is probably twofold. We're really interested in understanding how the experience of mental health changes over time. So in recent years, we've seen some escalation in mental health problems for children and young people, and we're really curious about that. And developmentally, so across the life course, how does sort of pathways of mental health and well-being change as young people reach different ages? But it's also about change as a result of some kind of support that's been put in place, you know, an intervention or you know, access to some services or something like that. So it's to do with sort of what outcomes can we achieve for young people when we put supports in place. So you can imagine that's some of that's about evaluating interventions and that kind of thing. And choice is really, it's a bit broader than the title might suggest, but it's about how we can give young people sort of equal footing or empower them to have a sort of more powerful voice in the treatments and supports that are offered to them, and, you know, finding a voice in those contexts, but also actually how can we make sure we're incorporating them into the research that we do. So not just in terms of getting their views, but actually hearing from them about the kind of research that they would like to see, asking them to work alongside us to shape what that research looks like, and asking them to help us communicate that to sort of wider audiences as well. So for each of these prongs in our key findings, we give some examples of the research that we've carried out within the year that fits into those categories. So today is really about giving you a flavour of some of those things. So each of our talks are going to focus separately on each of these themes. Next slide, please. Yes, just to remind everyone to follow us on Twitter. We will also be making links available in the chat throughout this work, which are sort of documents that you might be interested in, but please do engage with us on Twitter as well. We put a lot of our information on there, and it's a nice way to keep the communication going. Okay, great. Next slide, please. Thank you. So to start off our highlights, Tanya's going to talk to us initially about the theme around risk. Tanya, I'll hand over to you.
Thank you, Jess. Yes, so today I'll be talking about risk factors for mental health difficulties and well-being. Can you go to the next slide? Yeah. So according to the World Health Organization, health has long been defined as a state of complete physical, mental, and social well-being, and not merely the absence of a disease or infirmity. Despite this definition and the emphasis on well-being, many researchers focus primarily on mental illness, and we may be guilty of that as well. And even when researchers focus on well-being, they often focus on the symptoms of mental illness, and by the lack of a certain symptom, which they often refer to as well-being. And mental illness is, as we all know, is one of the major causes of life years lost and can cause a high burden for both the society and the individual. And there are so many longitudinal research that show that the precursors and the first onset of mental health disorders are often observed during childhood. So it is very important for us to understand the predictors of mental health difficulties at this age, to get a better insight into who might be at a greater risk of experiencing psychopathology throughout the life course. And this will help us, obviously, to provide more support during the critical times, and also know which kind of support we need to provide to individuals. And on the other hand, well-being is thought to be a combination of positive emotions, engagement, meaningful relationships, and a sense of accomplishment, or as flourishing in aspects of feeling and functioning. Can we go to the next slide, please? Thank you. Some consider well-being and mental ill health to be two ends of the same spectrum of mental health. However, there are some individuals who experience good well-being in the presence of mental ill health. And there are many individuals who do not have any mental health difficulties, but do not feel healthy or function well. So there is a model called Complete State Model of Mental Health, which combines these two spectrums, the well-being and mental ill health. And according to that, an individual may have a high mental illness symptoms and low well-being, which is called floundering, which is defined as complete mental illness. So these individuals have mental health difficulties as well as low well-being. There is another group of individuals who may have high mental illness symptoms but high well-being. So they are called struggling, which is defined as incomplete mental illness. On the other hand, there are individuals who may have low mental illness symptoms and low well-being at the same time, which is called languishing, which is described as incomplete mental health. Or some may have low mental illness symptoms and high well-being, and they're called flourishing, which is the complete mental health. And complete mental health, again, refers to those who have low mental illness symptoms as well as very high well-being. Can we go to the next slide, please? You may have seen this infographic before. I think at some point I have seen it whenever I joined a talk on mental health. And luckily, the authors of this infographic is very good colleagues of us. So we were able to talk more about their research and their findings, what it means. And just to describe you this graph, the part on the left side shows factors related to mental illness, and the parts on the right side show factors related to well-being. And the overlapping part in the middle shows factors related to both mental health difficulty and well-being. And this graph and their findings showed a very weak correlation, so a very weak association between mental health difficulties and well-being. And even by looking at this graph, you can see that not all factors influence mental health difficulties and well-being the same way. So some of these factors, for example, arguments with parents or being bullied by siblings and problems with getting along with peers, had an impact on both mental health difficulties as well as well-being for some kids. But some factors, such as having chronic illness or special education, only influence the mental health. So in other words, if, let's say, a child had special education needs, they had low mental health difficulties. Whereas some of the factors, such as being bullied by peers or not feeling safe in their neighborhood, only influence well-being. So kids who were bullied by their peers, according to this this analysis, show that they had lower well-being, but that did not impact the being bullied part, did not impact their mental health difficulty. Can we go to the next slide, please? Thank you. So we decided to investigate the same questions of what impacts mental health difficulties and well-being by looking at the data that we have from one of our projects called Head Start. And we explored if child and family demographic factors or child-reported emotional strengths and skills or sport networks in year 7 were predicts child mental health difficulties or subjective well-being in year 8. And our findings kind of echoed their findings. So we found a moderate correlation between mental health difficulties and well-being. And similar to the previous findings, we found that not all factors impacted both mental health problems and subjective well-being. When you look at the graph, you can see the factors on the y-axis, and the black lines that you see across are for subjective well-being, and the red lines are for mental health difficulties. And you see there are like little dots in the middle. And if the dot in the middle is filled, that means that that association was significant in our findings. And if the dot is not filled in, that means the association was not found to be significant in the current analysis. And you can see that half of these factors had an association between mental health difficulties as well as subjective well-being. And these included, for example, special education needs, free school meal eligibility, etc. So which kind of meant that if a child had, let's say, special education needs, they were more likely to have mental health difficulties as well as low well-being. But again, some factors such as empathy, social connection, child in need status were only related to mental health, whereas prosocial behavior, peer sports, community connection, etc., were only related to subjective well-being. Thank you. So overall, our findings show that the importance on not only focusing on preventing or treating mental health problems, but also focusing on improving children's well-being. And it also highlights that when we are trying to get a picture of how well a young person is functioning, we need to consider their mental health as well as their subjective well-being alongside each other. And lastly, it shows the importance of programs focusing on preventing or treating mental health problems, needing to also consider improving the well-being of children and young people. So thank you very much for listening. I'm sure you can find the article and a brief summary of the article online, which I'm sure the members of my team will share at some point, either if they haven't already. Thank you.
Thanks so much, Tanya. That's fantastic. I think it's really helpful, this sort of conceptualization of well-being and mental health as, different constructs on a sort of matrix. Great, thank you. So next, Emily Stapley is going to speak to us about one of our other themes, which is the resilience theme. Thanks, Emily.
Thanks, Jess. Hi, everyone. So I'm going to talk about what we've learned about young people's experiences of coping and receiving support. And that's what we've learned from speaking directly to young people themselves. Next slide, please. So the first study that I'm going to talk about is findings from our evaluation of the Head Start programme. So Head Start is a really large programme that is funded by the National Lottery Community Fund, and it aims to test and explore new approaches to early intervention and prevention in relation to young people's resilience, mental health and well-being. So Head Start as a programme is being delivered in 6 areas across England, and each of these 6 areas are doing lots of different things in the way of intervention and support providing. So some might be delivering peer mentoring, where young people receive support from an older student. Some might be delivering one-to-one support from an adult, where young people receive support from a youth practitioner or a counsellor. For some, it's group support sessions where young people learn about how to handle difficult feelings, situations and relationships in small group settings. Sometimes it's whole class interventions, so might be sort of things like almost PSHE style lessons where young people learn about, again, sort of coping emotions and relationships, but in a whole class or even whole year group format. So there's a whole range of different activities and different types of support going on that's all being delivered through this Head Start programme. So because Head Start is such a huge programme, and because there's all these little interventions going on and big interventions going on and different things here and some similar things there, it's really complicated to evaluate. So one of our questions is, so how do we evaluate how helpful these approaches are, including why they're helpful, in what ways, and from the perspectives of the people who are receiving them? And so the way that I have chosen to do this as part of our evaluation is to ask young people themselves what they think. Next slide, please. So from young people's perspectives, we heard that they have experienced improvements in their emotions and their behaviours as part of the support that they've received from Head Start. So I'm not linking these findings to any particular activities. And quite often these findings were common across the different activities that young people had taken part in as part of Head Start, which is interesting in itself, I think. So young people talked about feeling happier, or positive, or just better in general following support. They also talked about feeling more confident or feeling less angry, anxious, stressed, or sad. So I've got an example quote on the right, which I hope you can see, which is a young person talking about how through putting their hand up in the Head Start sessions, they then felt confident to be able to do that in lessons after the programme. So we also saw sort of school-related improvements from young people's perspectives. So not only feeling more confident, but they also talked about feeling more able to concentrate in lessons. Next slide, please. Young people also spoke about social improvements that they'd experienced. So not only in relation to the emotional side of things, but also in terms of their relationships with others. So they talked about making more friends. So that might be through sort of Head Start group activities, or it might be because they felt more confident socially. So then they were able to make more friends outside of Head Start support. They also talked about having fewer fights and arguments with peers and with family members. And sometimes that was due to feeling more able to not retaliate directly in situations, be able to think things through a bit more before reacting. And young people also referred to having the opportunity through Head Start to get out of the house and often to have fun doing lots of different things as part of Head Start support. And then finally, we heard from young people, particularly those actually, and I will ascribe this to a particular type of activity, particularly those who've been involved in participation or co-production activities, that they felt inspired to help others, or they'd learned how to do so through the Head Start sessions that they'd had. So just a couple of example quotes again on the right, which I won't read out, but please do have a quick read. And then we'll move on to the next slide. So in terms of what was actually helpful, young people spoke about how they'd been given particular resources, techniques, and advice for being able to manage emotions and behaviour. That it wasn't just that they started feeling better, but actually they'd got really specific ideas for how to handle them. And this was the same for their relationships with others. So actually feeling that they had the tools to be able to deal with this. They also talked about having fun, both as sort of a mechanism for why the support was helpful and as an outcome, which I just spoke about before. Flexibility of the support was important for young people, so in terms of its time and its location. And also having someone to talk to really underpinned a lot of what we heard from young people about why Head Start support was helpful. It was having someone available at a time when they needed it, which they could speak to about anything. And the next slide, please. So in terms of what was less helpful, so we heard from young people that sometimes there were difficulties with peers and group support sessions in particular. So sometimes not everyone got on, or sometimes there were differences in how people behaved, which could make it a bit more difficult. Not all young people felt able to talk about their problems, and sometimes they were hesitant to do so. Sometimes there were issues relating to the timing or the location of support, in that sometimes it just didn't suit them when the support was, if it was after school, for example. Sometimes young people weren't effectively signposted to support, so they'd been advised to attend a particular type of support, but then no one had ever facilitated them getting there. For example, someone at their school or a Head Start staff member, so they just hadn't started it. And then some young people felt that actually the support they'd received, it just hadn't had as much impact as they were hoping for, and problems that they were experiencing were still continuing. And the next slide, please. So off the back of these findings, so knowing that there are lots of different ways in which young people experience Head Start support, we also know that young people face varying levels of difficulty in life and have varying levels of resources available to them. So what we also wanted to do in another research project is look at how young people's experiences of coping and support might vary. So again, thinking about what we'd heard from young people through Head Start, we found that actually when we looked at what the young people had said to us, and we looked at that thematically across different time points over the course of the 6-year Head Start programme, we found that actually when young people were struggling more, they tended to more often identify limitations in the coping strategies that they used, or the support that they accessed. And that included things like sometimes the timing of support wasn't always particularly helpful, or it just wasn't as effective. And this was totally different to young people who were experiencing lower levels of difficulty in life over time, who found that actually they struggled less in terms of coping and having support that was effective to help them with their difficulties. And the next slide, please. So these findings tell us that implementing regular reviews with young people about what their support needs are, when they might need it, and what their preferences are is really important. These findings also tell us that preventative interventions could benefit from being multi-component, and this is to boost the resources available within young people's wider context, as well as within young people themselves. So this speaks to the theories of resilience, which emphasize the role of the individual's connections with the external systems in their lives in terms of promoting their own resilience and their capacity to cope. And the next slide. And then finally, what we also wanted to do is we were really conscious that all of the findings that we've been presenting from these research projects were very much framed in our language. So they came from interviews with young people, but then we had put our own spin in terms of language when we were discussing the themes that we'd identified from interviews. So we wanted to take it back to young people and ask them what's actually a meaningful way to present themes from our research. So we received funding from the National Institute for Health and Care Research to co-produce a taxonomy of help for young people. Needless to say, the taxonomy of help did not keep that name, as it's not particularly catchy. So we worked with the Head Start National Young People's Group to create this. And the next slide, please. So with the group, we decided on a name for the taxonomy, which I'll reveal in a second. We decided what names to give the themes. So for example, we had a coping strategies theme, and actually that then became coping techniques, because techniques was a more meaningful word to the young people's group. And then we also talked about things like colour, images, whether to have background music or not. And with the young people's help, we created the guide. And the next slide, please. So the taxonomy became How I Cope, a Young Person's Guide, and it became a series of short animations. So rather than having a series of sort of written description of each of our themes, which we typically presented, from young people's perspectives, animations were a way of being able to get the information across in an eye-catching and memorable way. So we're actually going to play one of these for you now, just so that you can get a flavour of what we did with the Young People's Group. And if you want to look at the whole taxonomy, then you can just Google UCL How I Cope and the guide should come up, or the web link will be in the slides, or we could potentially put it in the chat as well, I think. So I think yes, there we go. Lovely. Thank you very much. So yes, please do check out the guide if you're interested further, and I'll hand back to Jess.
Thanks so much, Emily. Still really enjoy watching that video, and music very calming. Great, thank you. So next up we have Julian, who's going to speak to us about some of the findings around the change theme. Thanks, Julian.
Thank you, Jess. And once again, yeah, a huge thank you everyone for joining us today. And one of the things we really like about presenting the key findings is the chance to hear from you, hear your views, whether the findings fit with your experiences, and also to help kind of shape our thinking about how we might take our work forward in the future. So yeah, please do put any kind of thoughts and comments into the chat. And yeah, I also wanted to say a huge thank you to the team for organising the session. So I'm really excited to be talking about change today, and I'm going to be picking on one study where we're looking at changes in parents and carers understanding stigma and experiences of support when receiving support from services focused on supporting children with multiple needs. So it's looking at kind of change in these characteristics over the course of receiving support. And yeah, I'm particularly passionate about talking about this and my other research areas, because it gives me a chance to bring together both my professional and lived experiences as well. I obviously want to start by saying a huge thank you to the parents and carers who contributed their views, who spoke to us. And, you know, we were speaking to them at a kind of challenging time. So we're really grateful for their support, but also to all of the services who made this research possible. I'd like to thank my colleagues who worked on this with me, particularly Jenna Jacob, who led the work, and finally a thank you to the funder. So on the next slide, we can see the reference to the paper that I'll be talking about. This paper isn't open access, so if you do want to check it out, you can always email me or my colleague Jenna, and we can send you a pre-publication version of the paper. So I'm going to be teasing out some of the key findings that I found most interesting from this study, and that the full information about methods and limitations can be found in the paper. And this paper is focusing on community forensic child and adolescent mental health services, or Afghans. So over the next slides, some of the messages that I'll be talking through are first of all kind of what community Afghans are, and these are services that support young people with multiple needs. I'll be going on after that to talk about what we heard from the parents and carers. So this was how they described having kind of joined up communication, and that the network of agencies was well coordinated. And finally, the parents and carers told us that they felt heard and supported by the support that they had received. And we know how important this is for this group, as there's a lot of stigma that they experience. So I'm now going to talk about what community Afghans are. So these were at the time newly commissioned services. There were 13 of them. And they were really designed to address what we know is a key gap in care for young people with multiple needs. So young people might be receiving support from lots of different agencies, and this can result in a lack of joined up working, confusion, duplication of effort, and things kind of falling through the net. So the aim of these services is really that professionals and family members can refer young people that they're concerned with in this context of multiple needs, or perhaps also involvement in crime and violence. In other research that we've done, we found that generally the young people receiving support are around 12 to 18 years, but actually they do support some younger children as well. In the next slide, we break down what this support might look like. So they provide three overarching types of support: consultation and advice. So this is where you can ring them up and get one-off advice. Perhaps it's you don't know what services are available that you can link in with. Perhaps you're concerned but not quite sure if you're concerned enough, or if you should be less concerned, so they can kind of help you think this through. That consultation and advice may then move on to the next level of support, case management. And this is where Afghans help to bring together the different agencies who might be supporting a family, so that they can be thinking together, but also to help try and move support along if there are blockages. And one of the interesting roles of this service is they can really try and help take a step back, because we know when there is a concern, when there is a risk, it can be really easy to actually lose sight of the voice of that family because we're concerned about managing this risk. They move with families metaphorically across different service and geographic thresholds, and they can also do direct work with family when needed. In the next slide, I just summarise what we did. So this was part of a larger piece of work, but here I'm going to focus on discussions that we had with 18 parents and carers from 5 agencies. In the next slide, I dive straight into some of the findings, and I am going to read out some of these quotes, even though I know it can be a bit cringy when I do so. But one of the things that really made such a difference to parents and carers was clear and prompt communication. And we know this sounds so simple, but it was really, really valued. He, community Afghans clinicians, always replied, and he was very prompt in supporting us. He always included me in emails. What parents and carers also appreciated was that this communication was not always only prompt, but it was also joined up. The community Afghans clinicians also spoke to the school, so it wasn't just me they were talking to, it was getting everybody involved in it, and that worked so much better. So not only does joining up help make things move along a bit quicker, but we also know how challenging it is for families when they're having to retell their story and repeat information. On the next slide, we begin to think about the help provided to families in navigating what can be a complex system of network, complex network of support services. Because our case is very complex, he, the community Afghans clinician, then dealt with the wider circle, so everyone felt that they could contact him to help with everything. What really seemed to help the community Afghans in this role in particular was that they had an interesting part to play, as they were part of the system, but they were also one step removed. So this helped them to have a bit of a kind of bird's eye view, but it also helped them to have a bit of a fresh voice in communications with the network. I move on to talk about holding a case in this slide. And here I'm representing the idea that community Afghans had a sort of parent or carer service type role for families. We were in limbo land. No one wanted to take that ownership and decision and responsibility of how we went to the next level, because we had lost the police interaction and guidance. So we needed someone there that would give us that. This holding or parental role provided both practical and emotional supports for parents and carers. So we can see, as one is mentioning, if I didn't have them, I'm not sure how I would have coped with everything myself. As a result of this support, parents and carers felt empowered in their interactions with services. Nothing felt daunting anymore, whereas I think before Afghans got involved, it felt very frightening and overwhelming, and we really didn't have the answers. What I think really helped parents to feel empowered was being validated and listened to by Afghan staff. It definitely feels like, yes, I hear you. We could never have got to that stage without someone saying, actually, we're listening to you, we're hearing what you're saying, and we think this is what your family needs. So this role of empowerment is so important, because we know that parents and carers, when doing their best to support their children in these challenging circumstances, they actually experience a lot of stigma and guilt. So finally, in the next slide, the last couple of quotes I wanted to draw our attention to was just what I found was particularly interesting about how this sense of empowerment extended not just to how families interacted with services, but also to interactions at home and in the home life as well. So now I can go about things a little bit differently, approaching situations at home differently for both of us, and this has helped the situation. They also gave us a plan for our child, which we're still following at the moment, with strategies on how to cope with her for her safety and also to help us. So in the next slide, I summarise hopefully what we've talked about, that community Afghans are services to support young people and families with multiple needs. The parents who'd received that support described experiencing joined up communication and that the network of agencies was better coordinated. And this all resulted in them feeling heard and supported, crucially important given the stigma and challenges we know that this group can experience. So finally, in the next slide, I just want to say thank you again. Please do get in touch to share your views on our overall body of research or this paper in particular. We have some references that I've mentioned in the next slide. And then finally, I will now hand it back over to Jess. Thank you.
Thanks so much, Julian. If we could just pop up that references slide, which is the next one, just so people can see, that'd be great. Thank you. Wonderful. It's really kind of showcases the breadth of the work, doesn't it, from lots of different settings. Great. Next up, we're going to have Sarah talking about some research that's actually still in development, so sort of very much hot off the press. So it actually doesn't feature in our key findings report this year. It probably will next year, but it is based very much on some foundational work that she already carried out this year, but we thought this bit would be of particular interest. So I'll hand over you to talk about this research and the choice themes. Sarah, thanks very much.
Thank you so much, Jess. So yes, as Jess mentioned, my research is really looking at young people's participation in mental health programming. And I conducted a qualitative study to understand young people and staff's experiences of being involved in collaborating on Head Start services. So on the next slide, I just wanted to kind of piece these three things together. So first, I'm going to be talking about the rights of the young people to be involved in these spaces. Then I'll be talking a little bit about just the youth and staff outcomes and how programs are shaped from young people being involved. And the final piece is just some of the facilitators and barriers to young people being involved. On the next slide, we're going to talk about the rights. So when we talk about youth participation, we're really talking about the active involvement and real influence of young people in the decisions that affect them. And this is based off of UNCRC's Article 12 about every child having the right to express their views, feelings, and wishes in all matters that affect them, and to have their views considered and taken seriously. So in the field of mental health intervention and delivery, we have this at an individual level where young people can be part of their treatment plans, but we also have it at a macro or systems level where young people have the right to be involved in decisions regarding the design and delivery or evaluation of mental health programs. So for this study, Emily had previously mentioned the Head Start program, and I worked with young people and talked to young people who had been involved in collaborating on the Head Start services with staff and asked them about their experiences of being involved in that collaboration, which will come up on the next slide. So when talking to the young people and to the staff as well, I asked, what are some experiences you've had from participating and being collaborators in creating the mental health programs? And these three themes really showed up: leadership, confidence, and therapeutic benefits. So for leadership, young people spoke about how they had increased opportunities to take on leadership roles, both in campaigns that they were really interested in, but also to be evaluators of outside services or to take on a leadership role in panels. And also they spoke about confidence. So many of the young people talked about their experiences when they initially started as a collaborator or a participant in developing a program. And they said that they were really shy or they didn't really feel confident to speak up and have their voice heard. But as they continued in that collaboration process, they felt more confident to share their opinions, to share their voice, and to take on some of the leadership roles that they had mentioned before. And the last theme that really stood out to me was this topic of therapeutic benefits. So obviously, some of the programs that we are creating and shaping for the young people, and the young people are shaping as well, are focused on mental health. And that in and of itself has therapeutic benefits. But in addition, when young people are collaborators and have influence in shaping the program, that also had therapeutic benefits. So one example was a campaign on bullying, and the young people had expressed interest in creating a podcast where they got to share about their own experiences of being bullied and then provide resources to other young people who might be going through an experience of being bullied. And the young people shared that just in that narrative of sharing their own experiences, they felt a sense of safety and support, but also there was a lot of meaning making. So they felt like their own experiences had contributed to helping their peers and helping other young people that were going through bullying themselves. On the next slide, we talked to the staff and we wanted to understand better how that collaboration process was affecting the staff involved in creating the programs alongside young people. And two themes really stood out. The first was an increased understanding of young people's experiences. So a lot of times when the staff had talked about their own experiences of being a young person, or they thought that the time period was really different. There was so much more going on in the world today. There were different problems going on during their time. And when they collaborated with young people in creating mental health programs, they had an increased understanding and empathy for what young people were going through in today's world. And also a second kind of topic came up around increased sense of trust in young people. So some staff members had mentioned that prior to coming into this collaborative process, they expected a lot of the work and the burden of responsibility to be on their shoulders. So they felt like they needed to have an agenda. They couldn't have any problems come up in the services. And they had to, if there was a problem that came up, they had to solve it quickly on their own. But in this collaborative process, they realized there's so much that the young people could offer, both from their own lived experiences, but also they had a lot of really creative solutions, or they were able to collaborate with the staff to give really individual experiences that would help shape the programs later on down the line. And so these staff members express a lot of increased trust in being able to work alongside the young people to create better programs. On the next slide, we talked a little bit, both to the staff and the young people, about what they felt were some programmatic outcomes. And one really big one that came out was that young people and staff both expressed that the topics, initiatives, and campaigns related to the program were very youth focused. One specific example that comes to mind is that there was a campaign on cybersecurity, and the adults or the staff members involved in this program were really focused on what are potential safety issues on the internet. Having the young people involved actually shaped the program a little bit differently, because the young people said, yeah, we know what the safety concerns are. We really want to understand what are the resources out there for us. When something does happen, who can we go to? What are some of the services that are available to us? So having young people involved actually made the program more youth focused and also just more beneficial to what the young people's needs were. Another thing that came out was the retention of young people within these programs. So when young people have agency and voice and choice in these programs, they felt a bit more responsible for the program. So young people who might have started at ages 12 or 13 years old continued with the program even when they aged out. Maybe they took on a different role, but they still wanted to be involved in helping shape the program and understanding how they could contribute to the resources long term. And the last piece that came out of this was an increased sense of safety and support within these community and school spaces. A lot of times, what came out from the young people's interviews was that initially, when they had started in a school space or in these community spaces, they weren't sure if they were going to be listened to. They doubted if their voice would actually influence anything. But as they engaged in this collaborative process, and as they felt the adults, the staff involved in these programs kind of create this space for them, they also felt safe and supported enough to be vulnerable enough to share their experiences in these spaces as well. And the last bit of this study looked at things that were either facilitators or barriers to young people's involvement. So the next slide is going to look at what helped young people be involved in these spaces. Two major things that go hand in hand were transparency and communication. So especially with staff, transparency was a key factor in having young people be involved with them. So staff shared that being able to be transparent, not just about what the program itself was going to, involve, but also about what the young people's role would be, how much voice or agency that they had, how much influence they would have, was a key factor in it. And they also mentioned that the young people understood that it wouldn't always be that they could influence everything or they could make every decision, but actually having the staff communicate that to them and be transparent about their limits of decision making or influence allowed them to feel more involved and made them want to be more involved in the long run. And also that this communication was a two-way street. So when young people didn't feel like things were working well, or if there was something that was getting in their way of being involved, feeling safe enough and supported enough to communicate that back to staff. And the final piece that I thought was really interesting about Head Start services is this idea around test and learn. So the staff were told that in this collaboration process that they were invited to test things out, and when things went well, like they could reflect on that, and when things didn't go so well, or if there was something that was getting in the way of that program feeling beneficial or successful, that they would learn from that. And this really, the staff really talked about how this kind of released a burden from their shoulders. They felt like the programs were fluid. They felt as though the programs can really be shaped by the young people, and that the collaboration process was stronger because of the test and learn strategy. And the next slide is going to focus a little bit about some of the barriers for young people's involvement. So one thing that came out of this was a lack of resources, and that could be financial or geographical, or it could be technological resources. So for example, during the pandemic, if young people didn't have access to a laptop or a phone, they might not be able to get onto the online meetings. For some young people, the meetings might be taking place really far away, or they had other barriers to accessing. And another barrier that gets in the way of young people collaborating alongside staff is when outside services had a lack of knowledge on youth participation and co-production. So sometimes the young people expressed that they felt like the involvement was more tokenistic, or that they were just a checkbox, that the adults or the staff members might have wanted them there, but their voice wasn't really changing anything, or their decision making wasn't actually influencing how the program or the service was shaped. And the final one was being able to balance requests or commitments. And this happened both for the staff and the young people. So the staff talking about just balancing young people's requests versus supervisory requests. And for the young people, it was actually trying to balance some of the commitments for their school or family life, and alongside their roles in the Head Start programs as collaborators. So the key messages, I know this is still a preliminary research, but some of the key messages is understanding kind of young people's involvement and experiences of collaboration, and how some of that can influence our programs and our young people long term. So thank you so much.
Thanks so much, Sarah. Yeah, really good to hear emerging learning as it's coming out of your analysis. That's great. Brilliant. So Sarah has just rounded off our talks. just as a reminder, these are all sort of featured in some way in our key findings reports, which I think was put in the chat earlier, but maybe we can pop it in again, just a link to that. But also, quite excitingly, nice to coincide with today, our brand new research web pages on the Anna Freud Centre website have just gone live today, and they've got a really nice resource which is a sort of searchable library of all our research findings, not just for the evidence-based practice unit but across the Anna Freud Centre. So there's lots and lots in there, and I think that's being put in the chat as well, so please do take a look at those as well. We have completely absorbed our break time, so maybe I think I do want to have enough time for the panel. I hope people can bear with us, maybe just stand up, shake your legs, turn around, maybe sit down again, and if I can ask maybe all the panel members to pop their cameras on, those who feel comfortable doing so anyway, and I can see people are beginning to put some questions in the Q&A, so please do keep adding things to the Q&A, and I will hand over to Martha now, who's going to walk us through this part of the session.
I just, weirdly enough, even though she can't see me, I literally just stood up, shook my legs and turned around before she even said it. So that's very bizarre.
I know you so well.
So yeah, thank you for everyone who's posting in the chat right now. Keep popping your questions in there. I'm going to kind of kick us off and not pick on people, but sort of go to the people I want to hear from first. So I think my first question to everyone on the panel is kind of, what is your kind of takeaway and reflection from everything you've just heard? We've heard quite a breadth of things. So what's kind of your main takeaway message? So give you a bit of a chance to ruminate on that. But I think I'll go to Vicky when she's ready.
I think from the first presentation with Tanya about the importance of promoting well-being and not just identifying poor mental health difficulties as they emerge, that I was really striking, because presumably some of those strategies that we can have in place could be quite cost effective and relatively easy for the majority of people to put in place for young people that they come across.
I think that's a great takeaway, and also amazing you've retained all that information from sort of an hour ago, so well done.
I have notes.
Still very impressive. I'm going to turn over to Selena now to see what her reflections are, and thank you for joining us.
Thanks, sorry for being late. Honestly, I was just like, there's quite a lot to take in, but I was quite impressed with just everything. It seems like really thorough, and I like how much like the young people have been taken into account when they've been involved. Yeah.
Thank you. I think that's a great reflection, and I think it is great to see that reflected in so much of the work. I'm going to turn over to Tanya now and find out what her takeaway was.
Thank you, Marta. I was quite struck by Sarah's presentation, because we know from all the literature and everything that we've been doing that it's very important to include young people for every stage of the research and the intervention. But it was great to see that how they continue being invested into something when they're involved in it, when they put something from themselves, they stay involved in it. So it was great to hear that.
That's nice. I think that segues nicely over to Sarah. What was your takeaway?
Thank you, Tanya. I really loved Emily's presentation with involving the young people in the takeaways and the key messages. I think the visuals were so eye-catching, and also it conveys the message without having to like read a ton. You still get the major takeaways of what really helps young people.
Great. Emily, what's your takeaway?
I think for me, and I should disclose my bias in that my PhD research focused on parents' perspectives when their child was struggling with their mental health. So for me, hearing about the parent carer perspectives in Afghans in Julian's presentation, and just about the really tiny things like just getting a reply from their child's practitioner, feeling like they were sort of kept in the loop, for me just really stands out. And I feel like sometimes those perspectives almost get put in the background, and actually they really deserve their own spotlight. So yeah, that's for me, I think.
Oh, I think that's a great point, Emily. Okay, Julian, what's your takeaway?
I guess I was thinking, so the prevalence survey, where they look at the kind of levels of mental health difficulties young people are in the population generally are experiencing. The latest one, I think, came out today. And again, we see a kind of increase in levels of difficulties compared to last year. And I guess kind of hearing all of the different things that we've been talking about, you know, it's such a complicated landscape. And I think the move to just focusing on the individual to all of those other factors in the kind of the relationships, the parents and carers, the school support, yeah, I think is really crucial and timely. And just building on Emily's points, I thought it was also interesting to hear how those kind of similar things were coming up in your talk, Sarah, about kind of transparency and communication, and how, yeah, I think there are all these, sort of going to repeat Emily, but all of these kind of things we can do to be empowering people, that, you know, sort of like Vicky was saying, are sort of cost effective and don't take much time, and we can sort of all be doing.
Thanks, Julian. Jess, what's your takeaway from everything you've heard?
I feel a bit like Selena, there's so much, it's hard to pick one thing. I suppose my natural habitat is quantitative research, although definitely not as adept as Tanya is. So I suppose what I'm struck with is more the qualitative side, because it just strikes me again and again how powerful it is when you can hear the perspectives of parents, of practitioners, of young people in their own words. And quite often, I think the quantitative research is really important. That's why it's my natural habitat. It's really important because it helps us look at those patterns and relationships in quite a detailed way, and sort of explore them over time and so on. But I think what the qualitative work gives us is the sort of the how and the why, and also those unexpected kind of findings, and like all those benefits that Sarah was describing, that some of those things are sort of quite nuanced or quite unexpected, and it's just a really nice opportunity to hear about some of those things. So yeah, that really struck me.
Great. Well, that was really interesting to hear everyone's kind of different takeaways and what they focus on. And it's also given us some time to sort of fill up the Q&A section. So I'm going to kick off with Julian, because there's a question in there that sort of goes with something I wanted to ask. This is about FCAMs. So the question was, what is the future of FCAMs and will it be expanded? And I suppose my question is very similar to that, in that do you think that model could be used in other areas or for other difficulties? So they kind of go together.
Thank you. I think those are really good questions. Yeah, I'm pleased to say that the community FCAM services have continued. I don't think they have necessarily kind of grown in number. And I think one of the reasons is there's very much a focus on them being kind of quite small, specialized teams that kind of focus and reach out into wide-ranging areas. So it's quite interesting over the initial stages of the pandemic to really see how their reach could actually increase quite a lot just by moving to doing things online. So I think whilst they might not have increased in size, I think they've, or in number, I think they've increased in reach. And yeah, I think how this model could be applicable to different areas is something, you know, that lots of people are really focused on, and particularly supporting neurodivergent young people. You know, we know there's a real need in a range of areas, whether it's waiting times for assessment or increasing recognition and identification in young women and girls. So I think this idea of having, you know, these kind of specialized teams that can be kind of rapidly feeding in to other types of services, yeah, I think has proved helpful in this instance, and I think could be helpful in other areas as well.
Great, thanks, Julian. So there's a couple of questions in the Q&A that kind of focus on the how of sort of involving young people and being collaborative with projects in schools. So I'm going to kind of collapse them together. So I'm going to sort of aim this at Emily and Sarah so you can tackle it together. So what sort of resources for supporting young people and getting them involved in the kind of creation and involvement in research are you kind of using, or would you point to, or sort of tips? And I suppose what sort of advice, particularly in maybe a school's context, would you have implementing that sort of thing there?
I think I can talk about engaging young people as participants in research, and then I'll hand over to Sarah to talk about engaging young people as active collaborators in building the research. So I think certainly we've been on quite a journey in terms of our research recruitment materials that we use. So we now use lots of different ways of presenting information to young people who are about to participate in our projects. So that might be pictorial information sheets where actually the information is a lot more digestible, it's eye-catching, it's not intimidating. We also use videos to explain studies to young people now, and also to explain what the experience, for example, is of completing outcome measures and things like that, just to try and make the process more transparent and feel a bit less alien. So that's one way that we use in terms of engaging young people as participants. I think another, in terms of actually in the work that I do in terms of interviewing young people, is really sort of making sure at the outset that you're being really clear that everything that they want to talk about in an interview, it's wholly up to them. There's no right, there's no wrong answers. They can say whatever they want, as much or as little. And you're really trying to kind of break down the power imbalance that's inherent really in you being an adult and speaking with a young person about sort of their personal experiences, and trying to make them feel as sort of comfortable and able to talk if they would like to. So that's some of the things that I'd say from participating in research projects point of view. But Sarah, I don't know from your perspective about collaborating.
Yeah, to add on to what Emily said, we did have 2 briefings that talked a little bit about just the process of collaboration, the different models of collaboration, and that would potentially be a helpful resource around how do we get young people involved, and in what ways can we get young people involved, because it's not there's not like one size fits all. Different programs will need different ways of involvement. Your aim of your service might mean that there is a lot of involvement from young people, but there's also certain programs where some decisions might be made from the staff, and it will have to be transparent and communicated that that the young person might not have as much decision-making power there. But just a few ways that the staff and young people shared was that the young person, it wasn't just about involving them in the decisions themselves. It was also about creating space for them to be young people. So yes, they worked on campaigns and they worked on projects and they were passionate about those projects. But in addition, they came into these spaces and they were allowed to just connect to peers, to have fun, to have games. And then when they've established those relationships, when they felt safe and supported, that's when the work on those campaigns and initiatives really took effect. So that's just one way of getting the young people to collaborate in school and community spaces, I think.
Both excellent answers, thank you. There's lots of stuff going on in the Q&A, but I kind of want to throw it back because we've talked a lot in the presentations and generally about the voice of parents and the inclusion of young people. So I kind of want to kick it back to our 2 kind of lived experience experts that we kind of have on the panel right now, and sort of thinking about what you've heard and some of what we talked about, but thinking about the future, sort of how could we be including parents and young people more in research further, in sort of shaping research questions, how we talk about that in the future, and how we maybe kind of influence funders and other people. And I suppose I'd throw that question out to the audience as well. Like, what are your thoughts on how we pull that in more? Happy for Vicky or Selena to ruminate and then unmute when you're ready. And if anybody wants to throw anything in the Q&A as well, please do.
I guess moving forward for the future, I think what sometimes irritates me as a parent of 2 neurodiverse young people, both of which have needed additional mental health support, is when a question asked of them or through me of them is never actually a question. It's not that the plan, the answer, the decision making has already been made, and it's almost like a trick. And I guess my kind of go back to is, yes, the situation is bleak at the moment in terms of the latest research that's come out. And yes, there needs to be funding, and yes, there needs to be this and that and the other, but some things are easily within everyone's power to change. And don't have a notice board that's 5 years out of date with a child's survey and views, because our young people nowadays can access all sorts of social media with a quick click, click, click. And that's what they're used to in terms of their feedback. And if your notice board is 5 years out of date, it's not relevant to them. And then when you ask their views, they sit there thinking, well, all my surroundings are outdated. You don't mean what you say. So I think from my point of view, sometimes the simplest things are the best, and remembering to go back to basics. As a parent for myself, I would say it's exhausting being in the situation, and it's even worse when you're having to be the key worker and keep pulling people back into decision making. So anything that somebody can do to look to move that away and not take power away, but come alongside and mean what you say and do what you say when you say you're going to do it. So those kind of things, I think, because I don't think people will join in with research and support.
Thanks, Vicky. That's really great. And I think that's very much important. And you're right, it's about getting people in before you even phrase the question. I think that's very much my takeaway from what you said. Selena, what are your thoughts?
I think generally I've been doing a lot of stuff here, like at the Anna Freud Centre. I think I do a lot of work like with research champions and stuff, and I think just in general asking people who are the age at which you are targeting the research is like always a good idea, especially because sometimes, well, I have a massive issue with like the idea of like under 18 and then like just like that being one like group, because I think but within that age gap, like people are so different and want different things. So I think maybe just either if you are dealing with like a large range, maybe change your like wording or questioning or resources a little bit for like smaller blocks of ages. Like I've had some experience of like social care and stuff, and like as a 16-year-old, I didn't really want to read the stuff that was meant for like 9-10-year-olds. Like it's not the wording that I want to look at. It's not like how I think about things. I'm not massively happy about like care about like my like happy house or my safe space. Like no, I'm thinking about my GCSEs and like stuff I have to do. I don't know, I just think it's being aware of the fact that young people are young people, but they are not all like one block. So I would just say like have people involved in the decision process from as early as you can make it. I know like it's not always possible because people might be like, I don't know, there might be reasons why you can't involve them, but I think just think where you can, try as much as possible and keep complicated jargon out of things, but don't oversimplify it because that can be a little bit condescending. Yeah.
I think that's a great point, and about finding that kind of balance between who you're speaking to and how you're speaking to them. So that's a good point. Did anyone else on the panel have any thoughts around how we could be bringing in these voices earlier in the process or at any point in the process and how we shape that? Go, Jess.
Old school, real hand. Just to say, I thought I could tie in a couple of other questions in the chat, because the piece of research that came before the bit that Sarah's just presented is a briefing that we have, and it is featured in the key findings document, so you should be able to find it. But that does showcase, yeah, some of these different ways. And I know I could see some people were asking what are the different ways you might use. And I think Selena's exactly right. Some of those, yeah, are limited, or there's different reasons why you might use different approaches. So it's not always that you're going to necessarily have full scope to say, let's put young people in the lead, but to at least consider that that's a possibility and think about what's the appropriate approach, I think is really important. And my bugbear, I think, is just being aware when you're asking young people for their time, a bit to what Vicky was saying, that it costs them to share their experience and share their time. So to really think about what they get out of that experience. And I'm definitely not saying we've cracked that, but I think we think about it a lot more now in terms of how can we help young people build skills through this process, or what might be a meaningful thing for them to get out of it, or can we help them on their career trajectory through some of the experiences that they have with us. I think that side's really important.
Anyone else before I move on to maybe our last question?
Could I just add that there was something that Sarah had said that came out in her research about how, I think it was Sarah that said about the trust grew in the young people that they were working with when they did co-production. And I was just thinking that actually, if you're managing a team of people, to really inspire your team to have the confidence to try co-production and to acknowledge that some things will work and some things won't, but that's okay, providing you're working in a safe manner, because that way you're empowering those individual staff members to give it a go. And then it's going to snowball on from there.
I think that's such a great point. And I've never had a conversation with any of our champions or lived experience experts that hasn't been beneficial and opened up something, even if it's something I've never even thought of. It's always really enhanced the work we're doing. So we're kind of coming to the end now. So I think I'm going to kick it over to Sarah for the last one, because people are really interested in this hot off the press kind of research and they want to know more. So I know we haven't published anything yet, but there's sort of a question about a bit more maybe about the journey on how you got to this kind of study, and is there any kind of lit review we could maybe have a look at in the offing, something very research focused and tantalizing. So I'm going to throw it over to Sarah, and then we'll go back to Jess to close.
So I guess to start off, what the journey was that I actually worked as a clinician in the US in school and community spaces. And a lot of the work that is being conducted in schools around mental health in the US is a lot of imposed planning. So we invite young people to groups, or they're part of an individualized education plan, and we have social emotional skills. And when I talk to young people, their conversation was that they wish that they had more choice, so they had more agency in what was being provided for them, or that some of the things that schools provide aren't actually that useful. They're saying, oh, this is what they think I need or I want, but this is actually not touching on the actual needs and wants that I have. So the research focus was a bit inspired by that, and understanding how young people have a lot to offer, and if we only look at ourselves, right, like the clinical or the adult staff as like we are the experts, we are the guides, and young people as the people who just need to be like guided or given resources to, we miss out on all of that lived experience that they can also contribute into our programs. And so that's sort of the inspiration around this study. And the second part about whether we have publications. So I know Jess mentioned the first two briefings. There is going to be more publications, hopefully, in the future around key findings. And then hopefully down the line, the study will be published as a thesis, fingers crossed. But yeah.
That's great. Thank you, Sarah. I just wanted to acknowledge there were lots of great things in the Q&A that we didn't get a chance to get to, and so many things I could have talked to everyone individually about. I just want to thank the panel very much for their time, but also this isn't the end of the conversation. Check out our web pages, have a look at the booklet, talk to us on Twitter, email us. We're all here and want to keep the conversation going. But I just really want to acknowledge the input of everyone here, and thank you so much for your time. I know it's a bit late and it's after work, so I'm going to pass over to Jess so we can round up and get on with our evenings.
Thanks, Martha. Yeah, and thanks to everybody. I think we've just got one last slide to whip up. Yeah, I won't try and summarise in a nutshell. We've shown such a diversity of research, and I think the best summary has come from actually the panel reflecting there. So all that remains for me to do is thank you all for joining and for persevering with us on a very, feels like, you know, I can't imagine how it's going to get darker. We're nowhere near the darkest day, are we? But anyway, it feels like we've all kind of hunkered down together. So thank you for that. Just a reminder of all those links to documents and things. I think we will be sending around slides to those who've attended. And yes, if you follow us on Twitter, essentially every time we have new findings, whether it's a paper, a briefing, you know, lovely videos like Emily's or a bit of a blog or something, it will all go on there. So if you want to keep up to date, that's definitely the place to look for things. But now we have our lovely shiny research pages. You should also be able to navigate those seamlessly and find whatever you like. There's some nice themes and topics that you can pick between. So you could also find some things that we haven't discussed, which I hope would be useful. So yeah, thank you to you all for joining. Thank you hugely to our speakers and to our panel, particularly to Vicky and Selena, who, yeah, really appreciate your inputs and and sort of putting time aside to do this. Thanks also to the events team, to Joe and Rachel, for making everything go so well and sorting the slides out and all of the resources in the chat and things, and to Martha for hosting the Q&A session. We will be doing more of these in the new year. We did one last month. They won't be every month. They'll probably be 2 or 3 times a year, but the plan is to do one in the spring. We like to adapt based on feedback. We should do, because we're researchers. But please do tell us what you liked, what you'd like to see more of, what you think we could do better on. And then we'll try and incorporate that as we go forwards. But yeah, have a good evening, everyone, and thanks very much.